Succes i veterinær praksis, podcast nummer 177. Hej og velkommen til. Dyrlæge Søren Pejstrup her. Dagens emne har jeg faktisk rigtig længe haft lyst til at tage op, og jeg håber, at du er lige så nysgerrig som jeg er, eller i det mindste interesseret i at lære mere om dagens emne. Jeg har fornemmelsen af, at jeg muligvis stikker hånden i hvepsereden her, og i virkeligheden synes jeg egentlig, at det ikke burde være sådan. Fordi vi kan da i det mindste prøve at se på en anden tankegang med nysgerrighed. I dag skal vi nemlig snakke om en holistisk tilgang med østlig filosofi, østlig medicin i bagagen. Og jeg har fået fat i en dyrlæge fra USA, som ved rigtig meget om det her. Og jeg synes, hun er interessant at snakke med, fordi at hun blander de to verdener og har fundet et sagligt og et videnskabeligt funderet sted at stå og kan fortælle os andre, eller mig, ignorante, om hvad det her indebærer. En vigtig pointe, Lili kommer med her i løbet af interviewet, er, at holistisk jo i virkeligheden betyder en helhed, eller et overblik, der tager det hele med. Og på den måde så udelukker østlig medicin ikke en vestlig tankegang. I virkeligheden så indeholder den faktisk det. Og hvis du ligesom jeg er uddannet sådan i en primær vestlig tilgang, så kunne vi måske alle sammen lære noget af, om ikke andet at være nysgerrig på at være en lille smule mere inkluderende. Det er i hvert fald mit håb med dagens episode, og jeg håber, du vil lytte med nysgerrighed. Og så over til interviewet med Dr. Lili Chen. Hi Lili, and welcome to the podcast.
Thank you for having me. Excited to be here.
So my first question is going to be, what is holistic medicine even? But before we start off, of course, I'd like to ask you about your journey, your background, and your story. I think most of my audience here in Scandinavia doesn't know you too well, I'm guessing. Mm-hmm. So please give us an overview of who you are.
Yeah, sure. Well, I'm Lily. I grew up in Taiwan, and I came to United States when I was 13. My story in veterinary medicine is, although like many people in this space, is I think I knew at the age of like 3 that I wanted to work with animals. Like that has always been my passion, and there has really not like any other alternative careers that I've considered. It's just a very natural evolution. So when I was in college, I studied biology and then went to vet school and did an internship. And I am a small animal general practitioner. I still focus on small animals only, like dogs and cats. When I started, I am, because classically trained as a veterinarian, and very Western, very traditional. My interest grew when there were cases where it just seemed like with the tools I have and the training I had, that sometimes they are very frustrating. So the story that I would share is that when I started in my first hospital as a general practitioner vet, I started building relationship with my client, right? Like you get to know them, you see the pets a lot, you bonded with the pet. And then I had a Black Labrador retriever named Lucy that I've been seeing for many, many years. And then eventually she got old and she had arthritis, and it was really hard for her to get up. But her health was good, like her organs and her systems, like everything was good. And you try, you put them on NSAIDs, you put them on pain medications, you try Adequan injections, and you talk about other things. It's just like one day mom just came in and be like, I have to put Lucy down because she just cannot get up. It's breaking my heart. Her quality of life is so bad. And it was breaking my heart because I just had a hard time having to euthanize a pet or arthritis when everything else, like the body still was healthy otherwise. And at that time, another doctor in my practice did practice acupuncture, and I've seen, results in those cases. And that's when I started to explore, like, can I, as a doctor, offer a little bit more than what I already know? So my journey started there. I got interested in modalities are a little bit beyond what I have already. Acupuncture was my introduction. And then from there, I would say that it really was, there were some cases that is miraculous. There have been more than a few cases where the parents come in and they're like, we're here for euthanasia because my dog cannot get up. I'm like, can I just please try some acupuncture? And the first case that day, right after the session, he got up and walked out of the exam, and mom was blown away. And that became one of my very good client and friend as well, because then I started seeing this pet regularly. And I think Monty was the name of that pet, lived a year or two of really good quality of life. And that was something that I could not achieve with just conventional medicine before. And that was my introduction. My journey as a vet also, and where I am now, is to create, I think, like a way of looking at a body where I feel like most of the time, or at least for me, when I was practicing more conventionally, the medicine is really reactive. Like I wait until the pet's sick and they're showing symptoms, and then we try to do all these things to support them. We do see them, we see them for vaccines, we see them like once a year, and we run the senior lab work. But we all know like their body progresses in such like faster rate, say for a person like for us, a year, and our change in our body, it's not comparable to a pet of what they can experience in a year. And usually we wait until, now they're not eating, now they're vomiting, now they're having diarrhea. And then we're trying to control the symptoms without taking a step back and like, okay, why did they start this? Like, what else do we need to do so this doesn't happen again? So the biggest thing of, I think, holistic medicine, to me, when people think holistic medicine, it's usually like, it's like the acupuncture or the herbals or the supplements or like things that are not conventional. But to me, a holistic medicine actually just means you take the whole body and you use all the modalities available to support this animal so that the body can heal itself rather than being reactive, waiting for sickness to happen and addressing the symptoms without correcting the underlying triggers or imbalance. So that's kind of what my world is now, like how I went from really conventional and then started with acupuncture, got really interested, and then, taken just a lot of additional like trainings and courses to learn a little bit more about different modalities that can support, and kind of taking a step back and trying to do medicine in a more preventive, proactive point of view and addressing the whole body rather than just looking at one piece of the symptom for that.
So I'm very Western trained and have, I think, very Western thinking. So my mind immediately goes to when you say holistic, that you might light some incense and give some herbal medicine and maybe sing a song, and then suddenly everything is well and good. And that is, of course, not the right way to look at it. So what I also hear you say is that you also bring in non-steroidals and injection and all what is I know as traditional, but you also bring in a lot of other stuff to offer a more variety. Is that what I'm hearing you saying?
It's yes, in essence, it's taking what we already know in conventional and adding an extra layer of like, okay, what else can we support this body with? The singing dancing helps, you know. I don't do a lot of that. But that's it's an interesting aspect. I think when people think about holistic medicine, there is that idea out there like, oh, it's kind of it's not scientific, it's not been proven.
Yes, exactly.
Yes, so we can take a step back and talk about that piece as well, because I definitely have some thoughts about that aspect of things. But if we even just say, let's focus on like the scientific piece of it, I think the first thing I will say is maybe the time just has not caught up with it. Like, let's take acupuncture, for example. Probably when I started, which is 15 years ago, acupuncture was really, people are like, oh, like, yeah, you sure you can try acupuncture, like, blah, blah. But if we are conventionally trained, most people don't actually believe it would help. It wouldn't harm. So, but now, fast forward 15 years later, there are tons and tons of research in human and pets proving that acupuncture works. And now it's a standard in a lot of the offerings in human and veterinary medicine. And I don't, it's probably beyond the scope of this conversation to go into the science of acupuncture and why that works. But there are scientific bases why when you insert needles into certain points, which we now know acupuncture points are like depressions where there is a rich nerve bundle, lymphatics, and blood vessels, and putting pressures on that specific area generates like sensory and chemical changes that goes to the spinal cord and then goes to the brain. And it does generate measurable changes. It is scientific. So when we talk about holistic medicine and that there is like, oh, no proof or no research, it may be the question of like, well, have we actually done the studies and the research to say if it works or not? A lot of the holistic medicine actually does have a whole lot of research if people were looking. I guess this is more of a personal point of view, is that when we do research, right, it costs money, it costs time. So for people to want to prove something, usually somebody has to want to spend the money and the time to do it. And we have a lot more, again, my personal point of view, we have a lot more research backing up certain conventional medicine because there's usually a company that can sponsor this research, is pushing it to prove it a certain way. Versus a lot of like holistic medicine isn't something that is like it's a drug or it's a thing. It's like something that, to be honest, like profitable for a company. Like, who wants to back up this research? So I do think that when people ask me about like scientific research, they are now more and more. But the biggest pullback is like, well, then who wants to fund this research? Because if it's a research that generates no money for anybody, then most people are doing it because they are trying to do it out of goodwill, or all of us are anecdotally trying to prove something. But I know anecdotally, sometimes it's hard for people to accept it as, a concrete piece of evidence. So I get that. And that is a struggle in holistic medicine.
So in my time, this reminds me actually, because in the time I've been a vet, we've changed to for example, look at the microbiome in the intestines. And I remember when some of the first research came out about this, there was disregarded as anecdotal and maybe a little bit stupid. So how can you cure depression with having a healthy gut biome? That doesn't make any sense. But as we learn, there's something called hormones, and they also live in the bloodstream, in the intestines. So maybe there could be. And now it's fairly common sense that if you have a healthy biome, you're more healthy overall. I have no idea whether this is a holistic approach or not, or you're nodding. But But my thinking about these things have changed a lot. So not just giving every single dog with diarrhea antibiotics, but actually give as little as possible, and actually knowing that I could make an animal more sick if I use the wrong antibiotics too long or in the wrong case, and then instead try to support the microbiome. And also for my allergic patients that have a skin disease, that is also try to balance the immune system. And that is, for me now, is common sense, but it wasn't like for 10 years ago even.
Exactly. And that's, I think the science and the research is a little bit slower in like having to prove certain things before people will accept it. But I'm glad you mentioned microbiome, because that is such a big part of what I do, and my passion is I used to really struggle, say, with like the allergy patient, right? Like they come in, they're itchy, and you have like, well, in the olden day, you have steroids and you have antibiotics, right? And now we have cytopoint, we have well. But then what happens is you put them on these drugs over and over and over. If you stop, they go back to itching. And usually what happens over time, if you don't change anything else, is that they actually do get worse over time. If all we do is put them on an endless cycle of like cytopoint or apoquel, at some point that animal comes back to you, be like, hey, this injection is not as effective, or we're getting all these other issues, and now we've on our like 5th round of antibiotics, and now the infection is resistant. It gets harder and harder to treat. And I've been there, and those are the cases that frustrated me a lot, or diarrhea that won't resolve. Like they come in with diarrhea, you give them metronidazole, they get better. And again, from diarrhea, you give them more metronidazole. And at some point, it's like, what is happening with the gut? I will tell you now, like I rarely have to prescribe antibiotics. I do think there is a time and right indication for antibiotics, but even in my own journey, I overused antibiotics before, because you get results very quickly. I think these days people want results really quickly, right? Like have diarrhea, we want to make it go away. But the long-term consequence is that we're setting up for a gut biome or a skin condition that is going to be harder to manage. And now there is that push, like I see it coming through. It's like, hey, we have to be very careful with our antibiotic use. Like that is now a conventional, right? Like a piece, a big push. Like antibiotic resistance is real. Now we have infections that we cannot cure. That's because over the course of time, we've relied too much on this and not allowing the body a chance to heal. I run microbiome testing on pretty much every single one of my patients. And I would say our modern animals, microbiome is really, really imbalanced. And that comes from many generations, because microbiome is first passed from the mother to, the offspring. And then throughout their life, it just depends on what they eat, if they take drugs, their environment, are they going to develop a healthy microbiome? But if they start out with a poor biome, there's no way for them to grow very good microbiome. And hence we see a lot of allergy issues, immune issues, diarrhea issues, GI issues. I found that all we need to do, if we can restore the microbiome to a more balanced and healthy state, most of these diseases actually just go away on their own, and we don't have to keep relying on drugs. So, I mean, that is such a big part. I am seeing so much more of the microbiome, and it makes me so happy. Like the gut microbiome, I think, as you said, now it's more accepted that, yes, this does make a difference. I think the next thing I would love to see is the skin microbiome. Because the skin itself also has a microbiome and a healthy flora. And when that's not there, that's when they can get more skin issues. So there's a way that I think we need to talk more about, like, how do we restore the microbiome on the skin rather than keep, for lack of better terms, stripping the microbiome away with more drugs and medications.
So that's two things, the acupuncture and the biome. What else is on a common day at your clinic? What else are you using often? Just to give me I'm curious what type of patients you see and what type of patients you can help the best.
So another big thing that I'm doing more of is prolotherapy and TRP injections, and I am also looking to do stem cell injections. I will tell you, as a conventional vet, before it used to be if I have a patient that come in, let's say cruciate ligament tears, right? The solution is surgery, right? We most often send them to surgery to repair, or not repair, or to stabilize the knee, and that has been the way I practiced. However, I will tell you that there are alternative pathways. Not every cruciate ligament tears, even complete tears, will need surgery. I have seen them have full recovery without surgery. I'm not saying one is better than the other, just the paths are different. I mean, even with surgery, there are consequences. It's not you do the surgery and that joint is fixed forever, because you're going in there, you're manipulating, bones and joints, and they have a long recovery. We talk about options. So an alternative thing, sometimes what we do is we do offer, say, a combination of acupuncture, laser, prolotherapy, which is an injection, PRP, platelet-rich plasma injection into the joint for that regenerative response, basically getting the body to heal. The ligament itself, of course, once it's torn, it's torn. I cannot make the ligament grow back. I cannot change the mechanics of that instability of the bone, but I can get the body to a place where there's not the inflammation and the swelling and the pain, and they can return to their normal function of life without surgery. So that's the piece also in my journey here that I sort of was an aha thing. I'm like, oh my God, like this is possible without surgery. I didn't know that. Or I didn't attempt it very much. I usually, had in the past offered surgery as the first option. So that's something that we see quite commonly. We use these modalities a lot for the orthopedic cases, of course, like not just cruciate tear, but anything that's related to joint issues. These can be quite successful. We do a lot of ozone therapy, which I don't know if you have experience of. I have heard from some of my colleagues that ozone therapy is much more common in Europe and other parts of the world than it is in the United States. I mean, it is available here. It's getting talked about a little bit more, but it certainly is not a standard of care.
No, I haven't heard about that used for animals. I know about it in humans. And I've heard talk about that it might be offered in Sweden, but I've never actually talked to a vet or to a nurse that uses it or know anything about it. So please give an overview of it.
Right, a quick summary. I mean, ozone is a way to the best way to think about it is a way to increase oxygenation within a tissue, depending on how you deliver it. So there are many different ways to deliver it. Ozone is a gas in itself. But the gas, if inhaled, is toxic to the body. That's why we hear people hear the ozone layer, right, in the sky. That is not good for you. Like you can't just breathe it in. However, if you can, if it's delivered into a tissue directly, it does change chemical pathways to increase oxygenation of the blood and to change the pathways from inflammatory pathway to more anti-inflammatory pathway. It's probably more chemistry than I can explain right now. But more so, ozone itself is antibacterial, antifungal, anti-inflammatory. And we use it in a lot of different ways. The easiest and the safest way is actually just take the gas and we do rectal insufflation. So we deliver the gas actually into rectal tissue because the mucosa of the rectal tissue can absorb the gas really quickly, and that gets delivered into the body really easily. And that can immediately help with the tissue getting it systemically. So, but it's a gentle dose. So usually they have to kind of come in pretty consistently to do that. But we do something as advanced as like something called UVBI, which is ultraviolet blood irradiation therapy, and that's taking the patient's blood, a set portion with like very specific concentration of ozone, putting it together and running it through a machine that delivers ultraviolet like irradiation light, and then introduce it back into the body. So that's the most systemic way to introduce it. The benefits of that, what I've used it for, is it's been really successful in like any patients with infections, inflammatory conditions, cancer patients are the ones that I use for the most. The researching people where they use this, they actually use it in people that have resistant infections that is not responsive to antibiotics anymore, that they can use this therapy to basically allow the body to get the infection under control more naturally. So, and that's been the human application, and that's what I'm using for in pets as well, and seeing really, really good results with that as well. So the ozone, we can either deliver it through rectal insufflation, we can deliver it through blood. I use it in acupuncture points. Sometimes I will combine it and either inject the gas itself, or I put the gas into like fluid, like saline, and inject the saline. You can take the saline and you can use it as like subcutaneous fluids so that they have that ozone in the fluid pocket as well. You can use ozonated liquid itself as a flushing, like topical flushing of wounds, because again, it's antibacterial, antifungal. So in replacement of using more like medication for these infections, I can rinse out the patient flushing topically. I am now exploring doing intraperitoneal injection of the gas for patients with abdominal cancers, because I've had colleagues who are doing it and getting really, really good results for being able to slow down growth of cancer. I have done injections of ozone into the cancer of like external cancers that I can see, but exploring doing it intraperitoneal as well. So that's one really, really cool therapy that we've had really good success and that I'm able to offer as part of our holistic therapy. We do a lot of this.
Good. That was actually new to me, that that was a thing. So that was nice to hear. Yeah. So how about the owners? Is there? I'm guessing yes, but is there any difference in the way that you talk to the owners or have conversations with the owners as a holistic pet than you did as before you started that?
Yeah, these appointments usually take a lot longer than what I was doing when I was doing more conventional appointments. The reason is that usually we are looking deeper. Generally, everything just takes me a lot longer and it's more challenging for me in some aspect. In conventional medicine, like if a patient presented for certain issues, I already know, like textbook, blah, 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 like follow up with this test and then follow up with this test. And this is the drug that I use and, recheck in a month. Like it's laid out for me. But when I am talking to a pet owner that are coming in for more holistic conversation, then we are taking in a lot more considerations. Like, okay, how old is this animal? What kind of diet has this animal been eating? Because the diet is a huge part of, our body. Are there things we need to do with nutrition? Water, we talk about water sources because most of the body is made out of water, and the water that they drink does matter because tap waters versus filter versus mineral versus we use like electrolytes reduced water, like all of these things matter. At what pH, like what are we trying to change? If I'm dealing with, say, like bladder stones, and pH matters, right? So I'm looking at that piece, I'm looking at diet, I'm looking at water. I am looking at their lifestyle. Are they getting enough stimulation? I'm looking at their personality. Are they happy? Are they stressed? Many animals these days are very anxious, like they have a lot of anxiety. And we know that anxiety translates into stress hormones that can translate into immunodepression and can translate into diseases, right? I don't think that piece is talked about enough or at all in conventional medicine, this emotional, physical connection. We know in people that when you are highly stressed out, it translates into physical symptoms. In animals, it does too. And I think that is a huge problem when I'm talking to these owners. I'm also talking about that piece. It's like, if there is stress in this pet's life, we have to find ways to deal with that and make that better, because me just trying to make this disease better isn't going to work if I didn't address say if it's there's a component of stress. So then we talk about lifestyle, we talk about behavior, we talk about how to heal that, we talk about the energetics of things, like some pets run cold, some pets run hot. And there are also ways to address that. We talk about herbals, we talk about supplements. So the way that I talk to pet owners these days is very comprehensive.
It sounds very comprehensive.
So there's a lot that goes into all of that. And then we come down and usually we make a plan of okay, I usually have, when I talk to them, I usually have a short-term goal and a long-term goal, because a lot of times they do come to me with a problem. Let's say the problem is cancer. Okay. Then I'm going to make a plan about what I'm doing with this cancer, right? I'm doing food and supplements and maybe IV vitamin C, maybe ozone. I make a plan about the cancer so I can address this problem. But I also make a long-term plan. I talk to them about okay, but we got here for a reason. The cancer was allowed to grow for a reason. We also have to turn off that signal. Otherwise, we're just allowing this to happen. So we also come back and we make a long-term plan. And that's when we go into all the things I just talked about, whether I think okay, the imbalance came from the chronic stress. How do we make that better? It came from a poor microbiome. What is our plan to make the microbiome better? It came from, vitamin deficiency. It came from heavy metal toxicity. Then we make a long-term plan. So we usually have short-term goals of how we make this problem better. And then we have a long-term plan of how we can, in essence, reprogram the body so that it doesn't keep triggering the disease state.
Yeah, so that was actually going to be my next question about the lifestyle and how you actually approach the pet in a day-to-day life, because I know in holistic medicine for humans, the way that you approach life in general is a thing, right? And I sort of had, for me personally, I had the same thing for like we talked about with the microbiome. When I first heard about meditation, I thought that was I had to shave my hair bald and live on a mountainside in India somewhere for it to work, and I missed it for quite some time as being out there and woo woo in a sense. And then someone came up with the brilliant idea of calling it mindfulness instead, and that somehow made me want to try it because it had a different name. And when I tried it, I said, "Oh, okay, that actually does something." And I've been doing it almost every day since for the last, I don't know, 5-6 years. So, and I wouldn't miss it for the world now. That was a side note, but that is a general way I approach life, but of course I can't make my dog or my cat meditate, but I can do something in the day-to-day life that is not spiritual or religious or not proven scientifically. I can actually make some changes that will actually make a huge difference without it being something I have to believe in for it to work. I'm not sure if I'm getting my point across, but
no, it makes a lot of sense. Like usually, I think the biggest barrier in holistic medicine, like you said, usually it's like people hear something and they already have an idea of what that is, and it's ooh, and it doesn't work, and like we make up a lot of assumptions about something already. But can it be that my first principle actually in holistic medicine is do no harm? And I think that is actually everybody, like when you're inducted into this profession, that was one of our vow, right? Like do no harm. And the best thing about holistic medicine is that it is very, very, very safe. There are things that I have done in more conventional route that you have to really sit down and be like, these are the side effects, these are the complications. We're trading the benefit with the risk. Are you willing to take up this risk for this benefit? Many modalities in holistic medicine really no serious side effects. Like acupuncture, the worst thing that can happen is nothing. Like it doesn't work, right? It's not going to cause a serious side effect. That's my first guiding principle. Are there holistic modalities that are a little bit more complicated? Yes. However, is it, again, it's like that analysis, like what is that right thing for you? Are you willing to at least just be open-minded? And if this therapy has no side effects or virtually no side effects and no downside, like why are we not willing to look at that piece and try it? Because maybe, like your example with the meditation, maybe, just maybe, it makes a difference. Then what's the downside?
Yeah. Well, it's definitely not harmful to sit still quiet for 15 minutes a couple of times a week. But some of the things that we could actually do for our clients or help them with is, can you maybe talk a little bit about that? Because we can't meditate with the pets, but is there something I can do without proper training in holistic medicine? Just some simple things I can do tomorrow morning when I get back to the clinic.
Are you talking about emotional health for animals, that kind of thing?
Yeah, or are you it might be a tall order to for you to educate me in the next 10 minutes on how I can be a holistic vet. But I'm looking for a simple thing, a way to approach this, a simple thing I can try out if I'm curious and interested, where I can maybe help some people, or I can educate myself on a simple first step, maybe.
Let me think. What is the easiest thing to do? That actually, it's a really good question, because I like all these things running through my head, and I'm like, oh, is that easy to do? We're all working towards the same goal, right? Like, we are just trying to make the animals' lives better. There are a lot of like controversies about different approaches. I will tell you, I mean, I'm willing to take a stand on this, is that I am a big proponent of fresh food diet. I absolutely 100%. I used to prescribe prescription diet and be like, you have kidney disease, you get KD. Like, you have stones, like, here's SO. And I don't want to go into all of that, but prescription diets are also like medications. Like, if I prescribe kidney diet, that diet's job is to address the kidneys. It does not care that the muscles are now not getting enough protein and is now like having atrophy and having issues. It just cares about making the kidneys better. So it's not a very holistic way of addressing nutrition in general. I think one thing that we have to kind of take a step back, the biggest difference between conventional medicine and holistic medicine, the one thing I may ask you to reconsider is that when we reach for certain things, are we doing it for convenience because it's easy and it just takes care of this problem? Or are we actually doing this, the whole body a favor by addressing and making sure the whole body is taken care of? When we reach for a drug, when we reach for a diet, when we ask about this, like, what is the goal? Like, am I just, and it's okay if the answer is like, I'm just trying to make vomiting go away, so I'm just going to give Serenia. Okay, that's okay. As long as you understand you're just making this problem go away. Like, you're not taking the time to look at like what got us here. And I think that's the biggest thing that I would ask any practitioner to take a step back and consider is, when that animal comes in for diarrhea, are you reaching for that one thing and be like, okay, I can make this problem better in 2 days because I know this works. But what are you missing with that approach? Like this, let's just take metronidazole, for example. Like, if I give an animal metronidazole, I'm going to make the diarrhea go away. What is metronidazole? It is an antibiotic. What else is it doing once it enters the body? And what are you doing about that? Like, am I just saying, I'm just going to make the diarrhea go away and it's out of my hands, I fix the problem, that's it? Like, we have to do a better job, because you are making the diarrhea go away. That's awesome. And then after the diarrhea goes away, what are you doing to restore the biome that's not being taken away by the antibiotics, so that this animal does not have to deal with resistant, infection or dysbiosis, and maybe stress and the reduced capacity to deal with other things because now the microbiome is altered. We have to take a bigger responsibility in our part in this. When we reach for a prescription diet, we know kidney diet has severely restricted protein. What are you doing about the systems that require the protein to thrive? Are we just going to ignore that problem until that animal is weak and can't stand up, and we just say, oh, that's too bad, but I fixed the kidneys? Like, that's not okay with me anymore. And I think if that's the piece I want to challenge you with, is the next case you get, take a step back and be like, okay, like, if you prescribe a treatment, what is this doing? And what are you going to follow up with that's going to help support that animal?
That was actually a really good answer for a difficult question. Good. That was nice. Thank you for that.
Sure.
So I've been receiving your newsletter since like 2020 or something, and you occasionally write something that is thought-provoking to me anyway. So that's been nice. But if people want to read more about you, or maybe follow your work, or is interested in dipping a toe into some of this thinking, please share some of your resources and where we can find you.
Yeah, so our practice has a website. It's integrativepet.com. Well, integrative pet in one word. We are very active on our Instagram, and our handle is @integrativepet. I have a separate Instagram, which a lot of it is my practice, but that's also my platform for sharing some things that are going on in my world, and it's Dr. Lily Chen. I actually have to check. I think it's Dr. Lily Chen.
I will put it in the show notes.
Yeah.
Yes.
If you are interested in some of the things that I'm talking about, as you mentioned, I do put newsletters out in the world, and we talk about these things and ask questions. And you can subscribe from our website if you want to be emailed to the newsletter. We also post the content of the newsletter as blogs onto the website as well. And on our website, we have a section that's dedicated to like the services we offer. So if you want to read a little bit more about the ozone therapy or the UVBI or the prolotherapy, PRP injections, there is a short summary of each of those services on our website as well.
Perfect. Well, thank you very much. It's been a very thought-provoking and also eye-opening conversation for me. So I'm very grateful that you took the time out to talk to us. Thank you very much, Lily Chen.
Oh, thank you so much for having me.
Husk, at du kan finde links og noter til dagens afsnit på SIVP.dk og så episodens nummer, for eksempel SIVP.dk/1. Og føler du et behov for at udvide dine faglige færdigheder, uden at skulle tage en hel dag væk fra familien og fra klinikken, så har jeg nogle online kurser til dig. Du har måske hørt mig sige det før, men du kan få en hel måneds gratis adgang. Og det kan du få med en speciel kode, som jeg ikke deler noget andet sted end her i podcasten. Og det er fordi, at dig, der lytter til podcast, du er noget helt særligt. På SIVP.dk/XYZ får du 4 ugers gratis adgang til kurserne og protokollerne på hjemmesiden. Alle kurserne har specifikke læringsmål, så du ved præcist, hvad du får ud af den tid, du investerer i det. Du kan for eksempel lære at lave en regelret neurologisk undersøgelse og bruge det allerede næste gang, du er på klinikken. Du kan også lære at tolke blodprøver, og du kan lære at lave et godt finlåsaspirat og tolke det sikkert. Der er meget mere, men kig over på SIVP.dk/XYZ og tilmeld dig den gratis adgang, så kan du se, hvad du kan lære og bruge allerede næste gang, du er på klinikken. Udover alt det, så får du også adgang til et lukket online forum, hvor du trygt og sikkert kan dele alle dine i gåseøjne dumme spørgsmål. Dem er der selvfølgelig ikke nogen af. Men vi er sammen om at lære. Du skal ikke lære alene. Vi er sammen om at blive bedre. Og så ved jeg godt, at der er nogen, der er bekymret for at tilmelde sig et medlemskab. De er måske bange for ikke at få det brugt. Og jeg ved godt, at du som lytter til det her, jo går op i din faglige udvikling, for ellers havde du jo ikke lyttet til podcast. Men skulle du nu alligevel være bekymret for at glemme at melde dig fra, når din gratis måned udløber, så skriv lige til mig. Jeg har nemlig resultatgaranti, og det betyder, at hvis ikke du ser resultater i din hverdag, så skal du selvfølgelig ikke betale for noget for at have været på kursus hos mig. Se på SIVP.dk/XYZ for at tilmelde dig en gratis måned med det samme. Vi ses!